Hey y'all, welcome to another day of Vlogmas. So today I am doing something that I have been avoiding for weeks at this point. I am checking to see the increase for my healthcare insurance. I already know that it's gone up. They've been sending me multiple emails telling me to decide if I'm going to keep the insurance or not. They haven't said in the emails how much the actual price will be, but they have said it is going up. And so they're telling me to log in. I also have until December 15th, and today's December 10th, to make a decision if I'm going to start the coverage in January, on January 1st. So here I go. Saving setup is telling me that I may not qualify for the same savings I did before. This stuff is so tricky. So that was a lot to go through, the application and everything. But when I finally got through, it said, do I want to use any of my tax credits to lower the cost of the health insurance? And I didn't know what, like, it let me decide how much of a tax credit I could use. And so it said, like, do I want to use all of it? But they were like, don't do this option if you think that the annual income that you estimated that you'll make in 2026 may go up. Like, it may be more than what you estimated. So they said, don't do that. I'm hoping that my income is going to be more than what I estimated. And so then it gave me the option to do some of it. And so I used some of the tax credit, and I used $100 per month. And so when it showed me the plans that are available, the same plan that I have now, it was going to be $448 a month, but because of the tax credit, it's $348 a month, which is basically what I pay now. So if I use the tax credit, it won't go up. So now I'm just like, is it worth keeping health insurance? And I guess that's a bigger question. Like, health insurance is worth it if something major happens. If you're in a car accident and you break your leg, stuff like that, I'm assuming it's worth it for that. Even though I saw a video today where an actual doctor went through the process of pricing out how much different procedures for women, like if you're having a baby, how much it would cost to deliver the baby with insurance than without insurance. And it was actually cheaper if you didn't have insurance. So now I'm just like, well, is it worth having? Because if I can save almost $350 a month, then it's worth it, right? Well, I don't know. I don't know if it's worth it or not. Is it worth saving $350 a month, which annually, how much is that? That's $4,200 that I'm spending on health insurance annually. Or that's assuming that I'll always have to pay for my own health insurance, like if I don't get a job in 2026. Is it worth to pay that annually for the peace of mind if something happens, I have health insurance? But sometimes it's actually not cheaper to have health insurance. So that's why I'm just like, I don't know. Recently, I also learned of something called direct primary care. Some people had actually left comments on a couple of videos saying to look into that. And so I did some research. And if you've never heard of direct primary care, it's basically like having a membership with a doctor. So instead of going to the hospital to work with it or to meet with a doctor, it's like you go to an independent doctor at their independently owned clinic, and you pay the doctor versus paying the insurance company. So they don't work with insurance companies, and you're just paying that doctor directly. And so from what I found, like, I did some research and I found some in my local area, and it was like $100 a month membership. And with that price, you can have unlimited visits to them. So if I get sick and I just need some prescription medication to feel better. Like instead of going to urgent care, I can just go to that doctor and I build like a actual relationship with that doctor, and I can go there unlimited amount of times per month, all for the price of $100. And they do lab work there, any other type of tests that I may need. Some of them for us ladies, like if we need like women based healthcare, I think you can do that with them as well. And it may vary like per doctor you go to, but it's a much more like customized relationship with your doctor, because if you've ever gone to the doctor and you felt like they only spent like 5 minutes with you, that's because a lot of times doctors that are working with insurance companies, they're being paid to see like as many people per day as they can, so that's why they don't spend a lot of time with you. Versus an independent doctor, they'll spend a lot more time with you, and you'll build like a real relationship with them, and they'll try to truly get to like the bottom of whatever your medical concern is. So if I had logged into healthcare.gov and saw that like it was going to double, then I was definitely not going to pay for that and just not have health insurance and instead do the direct primary care. But now that I see that it's basically staying the same, now I have a decision of like if it's worth keeping it. The direct primary care is not insurance. It's for people who don't have insurance. It's a way for you to still have access to a doctor without having to pay like crazy prices. They also can give you like prescription medication, and it's going to be significantly cheaper because insurance companies, they up the price of everything. So instead of like your medication being like $300, it may just be like $30 if you go through the direct primary care. So yeah, now I have a decision to make. I guess I don't have to make that decision until like another 5 days from now, but I don't know what I'm going to do. I guess it depends on how badly I want insurance, but I guess I'm starting to question like the real value of having health insurance and if it's worth it to just do out of pocket, this especially if I'm a relatively healthy person, which I am. So it's like with me being healthy, like what are the odds of some tragic accident happening to me? It's not probable, but it is possible, which is why I'm like, is it worth it? I don't know. I don't know. Let me know y'all's opinion. Yeah, let me know if you're in a similar situation. Oh, also, I did do some research. So I know it used to be a penalty if you didn't have health insurance, but now there's no longer a federal tax penalty for anyone who doesn't have health insurance. So that's not a concern anymore. There are some states that mandate that you have to have health insurance. So do your own research to see if your state requires you to have health insurance. My state does not. So that's like another thing. Like I'm not going to be penalized if I don't have health insurance. So it's just like, what are the odds of something happening to me? But you also can't just enroll in insurance at any point in time. It has to be during like the special enrollment period, which I think is also like a scam because there's not a special enrollment period for car insurance or house insurance. You just get it when you need it. So, like, why is there only a certain time of the year that you can sign up for health insurance? That's because it's all a scam. Because this is America and everything's a scam. Sorry, I'm just venting now. But yeah, I don't know what I'm gonna do. So if you're in a similar position or you know of people in your life who have been in a situation like mine, let me know down below what you think would be the best option of what I should do. Not to say I'm just gonna do whatever y'all tell me, but sometimes it's good to get other people's opinions, especially if they've had life experiences that you haven't had before. So um, hope y'all enjoyed this video of not really an update, but just kind of going through the process of navigating real life, real adult things like this. Yeah, no real like resolution in this video, but just kind of a stepping stone in the process of navigating things. So give it a thumbs up, leave some comments down below, give me some suggestions down below, and I will see y'all in the next video. Bye.